Hello and welcome. Today, we're delving into a lung disease called berylliosis, a condition that primarily affects the lungs after exposure to beryllium. We'll explore its causes, effects, diagnosis, and management, providing you with a comprehensive understanding of this often overlooked illness. Berylliosis, also known as chronic beryllium disease or CBD, is caused by inhaling beryllium dust or fumes. Beryllium is a lightweight metal used in many industries, including aerospace, electronics, nuclear energy, and dentistry. Exposure usually occurs in workplaces where beryllium is processed, machined, or handled. Not everyone exposed to beryllium develops berylliosis. Susceptibility is related to both the intensity and duration of exposure, and also an individual's genetic predisposition. When beryllium enters the lungs, it triggers an immune response. In susceptible individuals, the body recognizes beryllium as a foreign substance and initiates an inflammatory process. This process involves T lymphocytes, a type of white blood cell, which accumulate in the lungs and form granulomas, small clumps of inflammatory cells. These granulomas disrupt the normal structure and function of the lungs, impairing the exchange of oxygen and carbon dioxide. Over time, the inflammation and granuloma formation can lead to scarring and fibrosis of the lung tissue, making it harder to breathe. Berylliosis primarily affects workers in industries that process or use beryllium. These industries include aerospace, ceramics manufacturing, electronics, dental alloy production, and nuclear weapons production. The prevalence of berylliosis varies depending on the industry and the level of exposure controls. While the exact number of cases is difficult to determine, surveillance programs and medical screening have helped to identify affected individuals and monitor the disease's occurrence in at-risk populations. The symptoms of berylliosis can vary widely from mild to severe. Some individuals may experience no symptoms initially, while others may develop noticeable breathing difficulties. Common symptoms include shortness of breath, especially with exertion, a persistent dry cough, fatigue, chest pain, and weight loss. In severe cases, berylliosis can lead to significant lung impairment and respiratory failure. Symptoms may develop gradually over months or years after initial exposure to beryllium. Diagnosing berylliosis can be challenging, as its symptoms can resemble other lung diseases. The diagnostic process typically involves a combination of medical history, physical examination, lung function tests, and specialized tests to assess beryllium sensitivity. A key diagnostic test is the beryllium lymphocyte proliferation test, or BLPT, which measures the response of a person's immune cells to beryllium. A positive BLPT result indicates sensitization to beryllium. Lung imaging, such as chest X-rays or CT scans, can reveal the presence of granulomas and other lung abnormalities. In some cases, a lung biopsy may be necessary to confirm the diagnosis and rule out other conditions. While there aren't distinct classifications of berylliosis, it is typically categorized based on severity. Acute berylliosis, a less common form, occurs after high-level, short-term exposure to beryllium and presents with more immediate and severe symptoms. Chronic berylliosis, or CBD, is the more prevalent form and develops gradually over time with lower levels of exposure. The severity of CBD can range from mild, with minimal symptoms and lung impairment, to severe, with significant breathing difficulties and respiratory failure. There is no cure for berylliosis, but treatment focuses on managing symptoms and slowing disease progression. Corticosteroids, such as prednisone, are commonly used to reduce inflammation and suppress the immune response. Inhaled bronchodilators may be prescribed to open up the airways and improve breathing. Oxygen therapy may be necessary for individuals with significant lung impairment. Pulmonary rehabilitation programs can help patients improve their exercise tolerance and quality of life. In severe cases, lung transplantation may be considered as a last resort. Prevention is key to reducing the risk of berylliosis. Occupational safety measures are crucial in industries that use beryllium. These measures include providing adequate ventilation to remove beryllium dust and fumes from the air, using protective equipment such as respirators and gloves, and implementing strict hygiene practices. Regular medical surveillance programs, including beryllium exposure monitoring and BLPT testing, can help identify individuals who have been sensitized to beryllium and allow for early intervention. Worker education about the risks of beryllium exposure and proper safety precautions is also essential. The prognosis for berylliosis varies depending on the severity of the disease and the individual's response to treatment. Some individuals may have a relatively stable condition with minimal symptoms and normal lung function for many years, while others may experience progressive lung impairment and a decreased quality of life. Recent research has focused on identifying genetic markers that may predict susceptibility to berylliosis. Studies are also investigating new treatment strategies, such as targeted therapies that specifically inhibit the inflammatory pathways involved in the disease. Continued research efforts are aimed at improving our understanding of berylliosis and developing more effective prevention and treatment strategies. Thank you for joining us on this informative journey.